Health and Social Services. Prior to that, she was Deputy Chief Science Officer at the Patient-Centered Outcomes Research Institute. She's also taught as a professor of family and community medicine at UC San Francisco, and she's worked with a range of national organizations to advocate for health equity and access to quality health care for minority and underserved populations. And last, we'll have Clarence Carter. Clarence is the Director of the Office of Family Assistance and Acting Director of the Office of Community Services at HHS and ACF. And he was formerly the founder of the Institute for the Improvement of Human Condition, served as Director of Arizona's Department of Economic Security, and Commissioner of the Virginia Department of Social Services. So welcome to all of them, and I will turn it over to Bill.
Thank you, and I don't know how I'm going to squeeze 20 minutes into 7, but I will try. So Steve Wagner started this morning by urging us to focus on self-sufficiency and engagement and getting people off the sidelines. And one way to do that is to reconnect them to jobs and to the labor market. And that happens to be one of the big themes in my new book. So I am shamelessly promoting it today. Larry, thank you for having a birthday party for my book. It was literally released by my publisher just today. And for those of you who've written books, you know there's a long labor of love and hate that goes into it. So my book thanks you. Okay, I think we're supposed to focus on policy, and I'm really going to try to do that, although I was very impressed with so many of the researchers who were here and the clever things they're doing with data and with new approaches. Let me mention 5 approaches that I talk about in my book and that were also came up in one way or another today. The first is building skills. It's really about training and retraining. The second is tax credits, the earned income tax credits, but possibly others as well. The third is to what extent should we be using social insurance programs rather than means-tested approaches to deal with some new issues we're facing in our society. And the fourth is universal national service for young people. Okay, why those 4, and how does that relate to what we talked about today? First of all, why training? Well, I think that we heard today that even in a full employment economy, there's still structural problems, there's still a skills gap, and we have people who have not been drawn back into the labor market even though we are at full employment. Carolyn Heinrich showed us that we're not investing very much in this country, and she also pointed out that not all programs have been effective. She mentioned dislocated workers, for example, and she mentioned the success of sectoral employment programs, which I think are very effective, or particularly effective, for the same reason I think she does, which is you are really training people for jobs that actually exist. And more partnerships between business, community colleges, and employers are called for. I would add even a little harder than she did, or other people on that panel did, about getting the private sector involved. And why do we need to get them involved? Because that's where the money is. That's where the jobs are. And we just gave away $1.5 trillion to corporations. We didn't ask them to do anything differently for that money, and we're all hoping that they will use some of that money to invest not just in all the things they usually invest in, but that it will have spillover effects for their workers. But there's no guarantee of that, and so I think we need some modification of the tax law to encourage more private sector training, more private sector profit sharing with their workers. There are a number of very forward-looking companies right now that are doing that with some success. Why tax credits? Well, I think we all know, and you heard from the panel, the first panel today from Bradley Hardy and others, that they've been very successful. The Earned Income Tax Credit, it gets money to people and it encourages work. What's not to like here? And then it may even have these intergenerational effects we talked about in the last panel. We need this because wages have been stagnant, and we have too many people who, even if they're working full-time, cannot really support their families. And this is a big problem. So I have a tax credit proposal in my book. It's a little different than the EITC. It goes much further up the income scale to earnings of say, $40,000. It's based on your individual earnings, not your family income. It is very marriage friendly, and it is very good on reducing error, I think. Why do we need to think about social insurance and not just means-tested safety net programs? First of all, the economy has changed a lot. We have, as we all know well, a lot of new technologies. We have AI, we have robots, we have trade, we have decline in manufacturing. We have a lot of people who are losing jobs and don't have the skills to get into the new ones. Why not use social insurance to help people retrain? Why not lifelong learning accounts for that purpose? And if you put it in a social insurance system, it'll get better funded and it'll be more sustainable. It's not just economic change that we're dealing with, it's demographic change. You heard about that as well. Increased labor force participation of women on the second panel, growth of single-parent families. People have work-life balance issues that they didn't have 30, 40 years ago. What are we going to do about that? It's very hard to both take care of your family and work full-time. And so we do need child care subsidies, and we do need paid leave. Oh, I have 1 minute left. Anyway, I have some proposals in that area. And I could say much more about that. But since I only have half a minute here, why do we need national service, universal national service? We have a small program now called AmeriCorps, but it's very underfunded and very small. Because, as came out in panel 2, in a really interesting way, I thought, trust in each other and in our institutions is at an all-time low. And more government programs aren't going to solve the trust problem. And as that panel said, we need more civic engagement. We need more non-governmental programs. And, you know, government needs to organize this and help fund it somewhat, but I think this is one possible way to rebuild trust and sense of community, sense of civic engagement. I would add to universal national service what I call an American exchange program on the bottom half of the income distribution. So thank you for inviting me, and a pleasure to be here and hear from all of you.
Thank you. So Lonnie didn't mention when he introduced me that prior to coming to AEI, I am a former administrator and was the commissioner in both New York State and New York City for almost 20 years. So my remarks are going to be informed more by that than my experience here in Washington in the last 5 years at AEI. And when I was commissioner, I loved conferences like this because I would hear things that would then get me thinking, and I'd go back into my offices and we'd pursue them. And I heard a lot of things in the panels today that made me feel that way, and I wanted to go over them. So the first one was that Steve Wagner started us by making a very interesting remark about mandated or universal engagement in relation to work requirements. And he said they're not the same thing. And engagement is what is important. Work requirements may play a role, but this business that we're going to not let individuals who are clearly in need, who tell us they have no earnings and are not disabled and have no other source of cash, but are only on SNAP and Medicaid, we maybe shouldn't just say, well, that's okay, we'll see you in a year. Maybe engaging them ought to be something we should do. So the requirement isn't only on the recipient necessarily to do something, it's also on the program to wake up and pay attention to a constituent group that is in need. Secondly, I have to say, as a former state official, I love Don Winstead saying, other state officials, reporting requirements are your friends. That's very important because it is true that one of the roles that the federal government can have is asking the states to report, not just in the annual reports, but in between. How are they doing on various discrete problems, and what are they doing to address the problems of people in their caseloads? And I don't think we do enough of that. And so I was so happy to hear Don, as a state official and a federal official, say the federal government can play an even stronger role in raising data up about what's happening in caseloads and finding out what states are doing about those issues that are discovered. So I'm constantly talking about what's happening with working age adults who report no earnings, who, when their case is set up in SNAP or Medicaid or housing, how many are they, where are they, what zip codes, and what are states doing about them. I also have to say, Carolyn, I think, really hit it on the mark. The sort of distressing labor force participation numbers, despite the growth in our economy and the strength of our economy, is the one problem we really have got to get focused on in a more significant way. I was struck that she said that getting the workforce programs to work better, to find potential beneficiaries of their programs seems to be a problem. They set up a program and they can't find anybody to take advantage of those programs. But the lists are there, and maybe I'm harping on this a little more, but the public assistance programs, Medicaid and SNAP, have lists of individuals who are not disabled, who are working age, and say they have no earnings. We could do a better job of linking those programs with workforce development programs. I was very grateful to Bradley Hardy for pointing out that it is worthwhile to look at different populations and how they are benefiting or not benefiting from our economy or our safety net programs. And distinguishing between African Americans and other populations is an important thing to do, and it raises issues that need to be addressed and focused on. He also made a point that I think Belle makes very well in her book, and that is relieving poverty, helping people to have income or resources that gets them above the poverty line is an accomplishment, but it's not everything, and people are still struggling. And there's a second order of responsibility for all of us to help Americans who are in that lower middle class group who are struggling too and falling behind. How do we get them even further up? And so I think, the way I think of it is there really are two different jobs. One job is to help people get to the first ladder. Another job is to help people get further up. I worry that if poverty fighters try to get people all the way to the middle class, they will neither get them above poverty or get them to the middle class. But we shouldn't forget that there are two tasks that need to be tackled. So I thought Bradley was very good on that. Of the Marians, Marion Page, I have to say, Marion Page, I'm sorry, when we talk about poverty measures, I really think we have to really describe the inadequacy of the official poverty measure, the extent to which all of the things we do, or most of them, in the safety net programs are not counted in determining official poverty measure. There are others. There's the supplemental measure. There's the Christopher Weimer anchored measure of poverty that I think shows great progress in how our safety net program works. And then, of course, there's Bruce Meyer's consumption poverty measure. Those are important details to be aware of that shows that the people who work in the safety net program, the people in this country who've developed and created the safety net program, have made great progress in relieving material hardship. What we haven't done so well on is helping people earn their own success. And I think that's uncovered when we get past the official poverty measure. Marion Page, or Marion Bittler, you know, I ran the TANF program in New York State, in New York City. I was there when, you know, I was part of the first implementation team in New York State and New York City after the Welfare Reform Act passed. I do sometimes think we spend an awful amount of time still talking about TANF when we have these vast other programs that are much more significant in the lives of low-income Americans, and we don't spend enough time on those other ones. And that's the case here. A recent paper by Jason Furman, I think, very clearly showed that in response to the recession, our various safety net programs responded quite dramatically in shoring up incomes at the very bottom. They didn't do that much for people in the lower middle, but they did address issues concerning low-income Americans. And to just focus on TANF, I think misses that bigger picture. And I think that's important to remember. Also, I would point out that, we are, this is a HHS sponsored, so we can't spend that much time talking about SNAP, I understand, or EITC, but there are other programs within the HHS world. Like, I think we got a little bit into childcare, that was good. The childcare program is got important responsibilities and has gotten a significant new investment. I'd like to know more about how that's playing out. And then, we didn't say anything about child support enforcement today. Not a word, I don't think. And that is an important role in people's lives. I think it's been an unappreciated role in low-income families' lives, both in helping single parents, mostly mothers, get the support they deserve and should have to help them raise their children, but also to help the non-custodial parents both fulfill their responsibility and earn what they can to support their children. So I think that there's a sort of an underappreciated area there. And then finally, I was sort of struck by the topic titles and how they contrasted a little bit with what people decided to talk about. And so promoting opportunity and independence, and I think Carolyn was right on the labor force participation issue. That's really what we want to do. How are we going to get people to take advantage of the opportunity that employment offers and become independent? And what I'd like to see is a state-by-state evaluation of that labor force participation measure so we can see where are the labor force participation rates a little higher and why is that happening and what can we learn from those states to do both within our safety net programs and within our general policies to help people get to work. One of the favorite thing that I think two scholars did, and they put up a fancy chart and it had a lot of variation, right? The states are all over the place. And they said, this can't be optimal. And I get that, but we learn a lot from the differences. And what we really want to do is focus on those who are succeeding, call attention to it, and then bring that to the attention of those who are not succeeding. And that is one of the benefits of our federal system. And federal officials and state officials should be constantly looking at themselves in relation to themselves in the past and in relation to their fellow states so that we can all improve together. Thank you.
So I come here following about the opposite direction of Robert's trajectory, which is I started working with Robert.
And now you're here.
Now I'm in Wisconsin and in a county-run system. So it's been interesting to see from the federal research side and then back down to the state and in a county-administered system how some of this plays out. And I just have to say thank you to Robert and to Secretary Anderson, who are both here today, who are my mentors. So I just have to say thank you. So I think this timing of this discussion is fantastic because the economy is really good. And that presents an enormous opportunity and motivation for a focus on connecting those who are not engaged with employment. And so I think we have to remember in this audience that there are real people who have been disengaged and who haven't been able to connect with that ladder, and this economy is creating an environment where that is a realistic option for them. I talked with Milwaukee County judge a month ago, and he was saying, he did child support, and he said, for the first time in a long time, if a non-custodial parent comes into my courtroom, I can say, hey, go work with this person, and I have confidence that they will be able to get a job if they don't have some debilitating condition. And that is an encouraging place to be. So I think we just have to keep that in mind about the present opportunity. More specifically to sort of reactions to the panel, a few amplifications, a couple of things I hope we don't forget about, and a couple of research questions from my perspective. One amplification is on Don's point and to Robert's point as well. The importance of federalism and accountability struck me. It's easy to forget that we have federal statutes and federal rules and federal policy and federal dear colleague memos, and then we have state law and we have state rules and we have state policy, and all of these things they have purposes and they also constrain creativity, right? And so I think we have to be careful in restricting the space where state and federal governments can exercise some creative problem-solving capability in addressing some of the unique factors that different areas have. And I just wanted to put that back on people's minds. The second item is around families. You know, much of the research today focused on childcare, focused on TANF. We talked about the EITC. We talked about a few of these others. When it hits the ground, it's the same family, right? And so we are looking at these, you know, the marginal effects of the individual programs. And I think it's useful as we contemplate an agenda of research and thinking about practice, and certainly those at the state level know this, we have to keep in mind how these things work together and how we can have space for them to work together. Because if we're just looking at independent marginal effects, we're leaving a lot on the table, right? So number two, things I hope we don't forget about. We had a brief mention of, and I have not read your book, Belle, so I confess.
You
And
couldn't
maybe this-
possibly have, since it just got born.
Yeah, and so maybe this, maybe that's addressed in that book, but I think often we forget about some of the differences across the country in terms of how these programs operate. Service delivery in very rural areas is very, very different from cities. It just is. And so as we think about how these programs work and how they work together and what research looks like, I hope we keep in mind that some of the resources and integrative capabilities and administrative structures and effects really and cultural differences are just pretty vast. And again, I think pointing back to the value of some federalism and space for creativity, I think that's important to keep in mind. The second point, and Robert and I did not compare notes, but the absence of child support enforcement also struck me. Again, all of these programs come down often on one family, and a non-custodial parent is often a part of that family and is a key contributor to that. And if we look at the labor force participation challenges that have been mentioned, especially among less educated men, it would suggest to me that maybe the role of child support enforcement in helping non-custodial parents, and particularly fathers, move toward employment and supporting their families and being engaged in their families. And the research of Chetty that was discussed pointed that out today too. We looked at some of the mobility differences between communities where fathers were engaged and those where fathers were not. And so I think as we move forward, it's important not to forget about child support enforcement, not just in the capacity of extracting funds, but of being a critical support of a family and of parenthood and of engagement, of that non-custodial parent in employment engagement with the family. Number three is broad research questions. So one specific thing that would be of interest to me, we talked a little bit about disability. As probably many of you who work on the ground know, the trend has been going up, and it's kind of noticeable when you're on the ground. But I would be interested to know, particularly for children with disabilities who have been in the program, we looked at some of the evidence once they were on the program as kids and then were determined off as adults. It would be interesting to know at the outset if there were some way of researching what the future employment effects of entry into the program as kids versus other supports would show. And then the second one is really, we didn't talk a whole lot today about engaging people who are disengaged. We really didn't talk about that much. And that's the immediate opportunity. And I think there are a lot of challenges and sort of broader questions about What is the role of government in the lives of people who may not be in a program? And a lot of the people who are struggling most are totally disconnected. Maybe some of that is some of the cultural issues that you deal with. And maybe that's the approaches of our programs. Maybe that's the role of community groups. But some additional targeted looking at what engagement and activities leading to and supporting work, I think would be very beneficial moving forward. Thank you.
Thank you so much. So as a recovering academic family physician, I was excited to hear about regression analyses and economic modeling all day long. I don't get to think about that much in my role now as cabinet secretary, where we are challenged. I have authority over Medicaid, over SNAP, over TANF, over CCDF funding, and we're often trying to really think about the levers and evidence-based strategies to combine those authorities into ways that feel more seamless, not only for our staff, but also for our clients. And we are struggling with that. So I would love to have a group of thoughtful people help me figure out how to best use the range of data that we have to think about what's working and what's not. My state's small, it's about 1 million people, but yet we still are one of 2 states that has seen a downward trend in our poverty levels, and it's this intersection of culture and need and outreach. We're working very hard on engagement, but that word is a little bit fuzzy. And how do you best engage? What does that mean? How do you create these linkages with community partners who really know how to speak the lingo, who are from the community, of the community, and know how to create these trusting bonds? We're working hard on experimenting in a rapid cycle way, but that doesn't lend itself easily to programmatic evaluation and long-term trend lines. I think there are huge opportunities for us to move earlier and earlier in terms of apprenticeship and life skills training. We're really trying to think about how to build in flexibilities to do that and think about the dual generation approach. Our governor is committed to this, and we're bringing together cabinet agencies who have touch points with the same families, and we could probably count them and name them, but I could not tell you the way to connect the data points because there are many restrictions around how to do that at the state level. That would be something high on my agenda for policy solutions. Additionally, when you think about healthcare, we talked about it, one of Mary Ann's thoughtfully brought in Medicaid. There are huge, it's about half of my budget, but yet I can't yet pull in food policy from SNAP and WIC to help promote better health. That would lead to better savings and health outcomes, by the way, in my Medicaid population. Why is that so difficult? I have no idea. But I think a policy agenda that would leverage that ability would be incredible and influence the family unit and influence long-term outcomes that go beyond just the childhood phase. We're really also struggling with the disparities questions, particularly because we know that they exist. They exist whether you're looking at racial and ethnic disparities, language disparities, educational differences, differences in income level that have persisted. Intergenerational poverty certainly is influencing all kinds of outcomes that we're struggling with around violence and crime and social mobility, but yet we're really trying to figure out how do you move beyond just measuring it and create solutions around these social determinants of health. Maybe it is using TANF for housing, affordable housing. Maybe it's leveraging opportunity zones for investing in additional affordable housing, because those intersections don't yet exist, and we can't yet use other types of funding, again, whether it's Medicaid to promote better health for rapid rehousing strategies. I think that there are huge opportunities, again, to think about ways to merge these programs and silos and reporting and how we really move beyond. I don't think it's necessarily a UBI type approach as it's currently being experimented, but probably some new version of it that we haven't yet thought of or constructed, and with additional state flexibility from all of these siloed programs that, again, are probably going to the same set of at-risk, on the edge families who are reaching these benefits, but could be very powerful And in a small place or a small county level, you probably could really try out an experiment for a short duration and see what works for whom, under what circumstances. And I think that's our biggest challenge. If I would want to lay one priority out, it really is figuring out whether we're talking about engagement or outreach, we're talking about what is most effective. It's building in the evaluation along the way and investing in that as much as we invest in the administration reporting, because we have a lot of focus on making sure those error rates are in and we're doing the verification, but we don't necessarily have the same infrastructure in place for investing in the evaluation of components of programs that are working to get to people who most need it and to move them into sustainability and big wage jobs. Thank you.
As the administrator of the office that administers the TANF program, you might think that I would dedicate my 7 minutes to the TANF program. You would be wrong. I think, as I have heard today, that TANF is but a small piece of an exceedingly broader discussion about the American safety net. And I'd like to use my time to talk a little bit about the dysfunction and my hope of what I think is a perfect storm moment to completely rethink. Secretary Elder Walker asked the question, why is it so difficult to be able to use the programs that I administer in conjunction to achieve some kind of other result? The reason it's so difficult is because they were never intended to work together. Each one of those programs were designed singularly with a singular intention. And so therefore, we end up at the operating level trying to rig those things together with bubble gum and spit to make something happen. It is my principal argument that our safety net, it is an aggregation of single-purpose programs that was designed without any intention. And so therefore, if you don't know where you're going, any road will lead you there. And I would argue that first, that what we need to have is a true north or an overarching intention. And I would say that overarching intention ought to be growing the capacity of as many vulnerable individuals and families, growing them beyond that vulnerability to be able to reduce their dependency. We ought to see the system of public supports in our society as a mile marker in a life's journey, not a destination unto itself. And so, if we were to have this overarching objective, which would be to grow capacity to reduce dependency, to enhance the human condition, then we could then align all of our assets in support of that objective. I would argue that part of the challenge of the design of our system is that what program administrators are held accountable for is the administration of programs. They are not held accountable for enhancing the human condition. They are not held accountable for strengthening the individuals in their communities. Now, they come to the work with that intention, but that's not what they get held accountable for. And you just heard the Secretary talk about, of course, all the reporting requirements. And if those things don't happen, that's what you get dinged for. Okay? And so I would argue that if we approached the system of public supports, the safety net, with an objective in strengthening the human condition, to grow as many people beyond that, beyond their vulnerabilities as possible, so that they could live a life of their own choosing with reduced supports, that would completely change the trajectory of the way our system works. Robert Dorr said he was chagrined that there was no discussion of child support enforcement. And I think that that buttresses the point that I am making, that when you attempt to approach the discussion from the category of individual programs or individual silos, you're going to leave something out, okay? But when you think about human well-being, when you think about the notion of growing people beyond, then all of it makes sense. That you have to factor in, you have to focus on work, you have to focus on nutrition, you have to focus on education, you have to focus on family connectivity. All of those things become part of the discussion when you have an overarching intention to strengthen that individual or family and help them grow beyond that movement. And so I think that we have to use this perfect storm moment to shift our intention from the administration of individual programs to a focus on growing the capacity of our society, strengthening our society by strengthening her people. And with that being our predicate, it would allow us to align all of the potential resources in furtherance of that objective.
So I'm not even sure I'm needed up here, but we want to open it up for discussion. And I really, this is a great opportunity to get ideas out there. So, feel free to ask questions or feel free to pose ideas, to pose thoughts. How do we think about implementing a vision like the one that Clarence proposes? How do we design it? How do we implement it? How do we pay for it? How might we best engage different populations? How might we better coordinate, given the current system we have across silos, across populations, and across programs that are largely serving the same people? And then, I personally would love to hear from some of the policymakers and practitioners. What are key research questions you really need answered and that you need the research community to address? So with that, I'm going to open it up.
Good afternoon. My name is Sherelle Campbell Street. I'm from the wonderful state, the volunteer state, Tennessee. Today I just want to say thank you very much to each of the panelists and the information that has been provided. But I want to introduce a program that we have not really talked about in terms of serving persons with disabilities, and that's the Vocational Rehabilitation Program. I've heard a lot today about services to persons with disabilities in terms of employability, but one thing that we have not talked about is the VR program. There are over 80 programs, one in each state, and its sole purpose is to assist people with disabilities to go to work. I would be interested in, from a research standpoint, to find out, has there been any work or research done to find out exactly how wonderful that program has been in assisting people go to work. Additionally, when President Barack Obama signed into law the Workforce Innovation and Opportunities Act in 2014, there was a mandate in the law that stated that the VR program would now have to set aside 15% of its total budget for services to students with disabilities. Now, what makes that different is, for the first time ever, we would have to serve as a program those students with disabilities who are 14 years of age and older. This includes those students and families that are receiving SSI and SSDI. One of the things that you would do through that service is pre-employment transition services. Now, I didn't come up with the acronym PETS, but that's what it is. But pre-employment transition services is geared toward assisting youth with disabilities get a first-hand knowledge on how it is in terms of job readiness, what things you need to know about job readiness, about work at an earlier age. Additionally, with the VR program, one who receives SSI or SSDI is presumptively eligible for the program, and a lot of the services for which we are talking about is covered under training for the VR program. So as we talk about services for persons with disabilities, let us keep in mind that the VR program has been around almost 100 years. It resides in the Department of Education, the Rehabilitation Services Administration. The administrator, I believe, is right across the street. And it is a very good program, but it would be interesting to know just how other states are utilizing that. The other thing is, I've heard a lot of discussion about medically frail or incapacitated. I would want us to be mindful of how we speak of the people that we have the honor and privilege of serving. This is around the work of framing how we talk about people. Assuming that someone with a disability cannot work or is socially impacted by their disability at a disadvantage without first giving them the opportunity to at least try, I think is doing a disservice. We should first seek to assist until proven that those services cannot result in competitive integrated employment. So just wanted to get those points out. And lastly, to shout out Clarence Carter. One thing that I have learned in my role as Deputy Commissioner with the state of Tennessee is, man wrote laws. And a lot of the federal laws that are written have a lot of things like shall and may in it. I would encourage everyone in here to go back and read to see where there are opportunities to be more innovative. Just because something has been done the exact same way over 20 years does not mean that that is the case today. There's a lot of human service value curve opportunities out there, a lot of intergenerational opportunities. We created a new eligibility using language from CCDF to serve people who economically did not qualify to be a part of TANF. However, they were still poor enough that they needed child care, and the only thing they needed was child care. And we have Smart Steps in Tennessee, and that serves people who need assistance only with child care. They didn't ask for SNAP, they didn't ask for TANF, but they do need assistance in caring for their children. So I would just encourage everyone, go back, talk to your federal partners as we've done with Clarence and say, this is what we want to do. If we don't hear from you, we're going to assume that's yes, we can do it.
So there's a...
I want to thank you for bringing the disability issue up. I was particularly impressed with Manasi's charts. One of the benefits of, we believed in New York that there was a way to engage individuals who may have a physical or mental incapacity and get them on the path toward employment and make sure they had every opportunity. And I have felt for some time that the SSI and SSDI programs don't sufficiently make that possible once people are determined eligible. And I think that is an area where a lot of opportunity for innovation could happen. I did notice that the caseloads and the entrance to disability have dropped in the last year or two. And I think that's partly because this opportunity of the economy has made work more attractive, and I think that we ought to continue in the way that you described in trying to never give up on the possibilities of people who want to work to work.
If I could, Sherelle, I think that your point, it speaks to another aspect of this transformation that I hope that we can usher in. If we can move from a system that operates from the perspective of the program administered to the perspective of the person or family served, and begin the conversation there. What is it that that person or that family needs to grow beyond this moment? Then we can look out to the constellation of assets to meet that objective, as opposed to working down through the program and say, this is what I have to be able to do. So it allows, we need to shift the lens from the program to the person or family.
Good afternoon. I'm from the Child Support Office in DC, so I'm so glad that you guys mentioned child support, and I thought it was interesting that it wasn't mentioned when child support literally lifts kids out of poverty. It's not making women rich. It's literally $200 a month. It's the difference between poverty and not being in poverty. So I thought it was interesting that it was never mentioned. I'm in the policy division, and I guess I was looking for, I don't want to say new ideas, but for lack of a better word, we already are taking a holistic approach to child support. We have 3 people in our office who are dedicated exclusively to helping non-custodial parents find jobs. We are at court, we have a father in court program where we work with the court where we deal with the psychological issues surrounding child support. We help fathers become better fathers by giving them tickets to take their kids to see a baseball game. So, I'm not trying to say we've done everything that we can do, but I guess I was looking for newer ideas, things that I could take back, because that's kind of why they sent me here. We've already taken a holistic approach. Another issue that we're having, though, is that some of our child support rolls are going down, as are TANF, and it's not because people are getting out of poverty, it's because poor people can't afford to live in DC. So I think that when we're analyzing information, we need to make sure it's not like, oh, it's getting better. No, the poor people are just kind of shifting in another direction. So I'm not sure if that was a question, but thank you for acknowledging the importance of child support.
Yeah. I was the child support director in New York, and we also have the non-custodial parent EITC, which I think you have in the district as well. That's another way you can incentivize the payment of child support. There are efforts to forgive arrearage. There's ways to address child support debt when people are incarcerated. Those are ideas. But the thing that I think is needed is a greater effort to engage custodial parents in other programs that don't have a strong linkage to child support enforcement, the way TANF does. So SNAP and Medicaid, there are many single-parent households there who are receiving public assistance and getting no child support, don't have a child support order, don't have paternity established. And those services are important services that actually benefit both the family and the child and the mom and the dad if they are properly executed. And I think for some time now, the Child Support Enforcement Office has been afraid or reluctant to market the benefits of its program to custodial parents who are benefiting from other public assistance programs. And I would urge you to work on that. Some people are going to say no. I think that's actually not in the long-term interests of their families, but we can do a better job there.
So I have a couple comments. One, I want to go back to the issue that Mary Ann raised. I'm thinking of welfare programs like the EITC and food stamps and the non-welfare programs that provide benefits to children and their families as investments. Because I think that relates to the title, Rethinking Welfare, Promoting Opportunity and Independence. So if there's evidence that providing security through income transfers leads to independence and opportunity of the children, we need to pay attention to that. And I think it's useful to frame the discussion. You think about historically, what the United States led the world in is free public education. No one talks about work testing education. And nowadays, we can think of medical care as being like education. We know that medical care is essential for development of children. The evidence there is overwhelming. We've got today a presentation of the importance of income for the good development of children. And I want to finish with one suggestion. It goes back to what Bill has looked, which I haven't looked at, but I look forward to reading. But I want to suggest one thing, because she did mention child tax credits. So the child tax credit is now $2,000 per child. Everyone gets it, except the very rich and the relatively poor. There are many more poor people don't get it, but the cost of extending eligibility to the poor children who are not now eligible, to give them $2,000 a year is only about $12 billion. That would provide economic security for the poorest children in the country. I can't think of a better investment to promote opportunity and independence of those children. And I hope all of you in this room will think about it.
Thank you, everybody on the panel. Mr. Carter, I wrote down almost everything you said because I'm right with you. I agree wholeheartedly with what you're saying. And I think most of the states, we have moved to a more holistic approach to families. But I really like focusing on how are we strengthening the human condition. But my question to you is, when it comes to data, if we could share data around within our agency with researchers, that would be really helpful. But federal law, federal regulation oftentimes prohibits us from sharing data. If we could move money, federal money, and allocate it for workforce or other things from one staff to another, that would be really helpful. But federal law and federal regulations prohibit that. We're supposed to keep track of different statistics and analytics of what we're doing, focusing more on taking actions, not on strengthening the human condition. And the reason we do that is because federal law and regulation requires it. So I guess my question is, when is the federal law and regulation going to change so that we can focus on the human condition? Thank you.
A couple of thoughts in response. The first is, it would be very helpful when a state is attempting to do something specific that you can show that the rules confound, to bring that to our attention and allow us to bring together our federal colleagues to see if we can't help figure a way through that. Okay? Another dimension of that is, there are times, and because I have been on both sides of this equation, both federal, state, and local, there are often times when the states cede authority to the federal government that it doesn't have. And so a combination of sort of understanding a particular policy or regulation, okay, and then allowing us an opportunity to have a specific conversation about what the objective is, to see where we can help. What that will allow us to do is, in the near term, demonstrate two things. Demonstrate, one, the effectiveness of freeing up the state and the locality to be able to employ its vision, and it will also showcase the stupidity of some of the rules that we have. That we don't have, we are able to have an abstract conversation about this rule doesn't work with that rule. If we're able to show specifically where they are confounding us from achieving the objective of growing capacity to reduce dependency, I think that will create an environment more conducive to being able to change the policy construct. Just one closeout thought. We had a conversation with the state of Ohio. Ohio wanted to have a waiver. The previous administration had allowed waiver authority around the work requirements in TANF. And there was only one state that had submitted an application for that waiver. Well, it sat for 2 years. And then when this administration came in place, one of the first objectives in Health and Human Services was to close down that waiver authority, because we didn't want to do anything that could even be perceived to reduce the work, to reduce the emphasis on employment. And so Ohio had again put in that request, And what we were directed to do was we could not grant that authority, but we said we're directed to work with Ohio to see if we could help them achieve their objective. Their senior policy folks came in and sat with our policy team. They laid out their objective, and in the morning, we were able to help them figure out how they could accomplish that which they set out to accomplish without a waiver. It was a simple thing, but it was a specific ask around a specific set of challenges. So that's why I go back to raise the issue, and we can certainly convene our partners to see if we can help you work through what it is you're ultimately trying to achieve.
Hi, Russ Sykes from APHSA. I have a question in the tax policy world that hasn't been brought up, and I'd like to see what your thoughts are. One, Robert, I'm glad you mentioned that New York is a forerunner with the non-custodial EITC, which I think makes a lot of difference for people that are current in their child support. But the other place New York is a forerunner, we're the only state in the country that has made our child dependent care credit refundable. The fact of the matter is the federal credit only offsets tax liability, and even though our eligibility is tied to the federal credit, we fully refund the excess over and above the family's liability, which helps reimburse them for their out-of-pocket child care costs, which have soared to a level above the cost of a public university. And I'm curious, while it would be costly, it seems to be would be an enormous help for a lot of middle-income families, particularly that are not being helped in that fashion, cannot get subsidies. And it also would drive more people to formal care, because you're not able to claim that credit unless you're using someone who reports their income and so forth. So I'm just curious your reaction to Robert, anyway.
It's a very good question, and I think, I can't remember if it was the Marians or Liz who mentioned the refundable version of the child care tax credit, and the fact that as it exists now, it's not refundable, and it is very, very tilted towards very well off, very affluent families with children. And so there is bipartisan legislation that's been introduced in the Congress, I think it was in the House, if I remember correctly, to do exactly that. So the issue is on the agenda, and it even has some bipartisan support. So I guess my advice is keep raising that and keep fighting for it.
And I would just say, I think that the area of child care assistance is just way too complicated. I mean, there's the child care tax credit, refundable or not. There's the child tax credit, refundable or not. There's the child care block grant, which just got a significant increase. And certainly as former administrators, we use that to help low-income families afford child care. And then there's the quality issues. So I think that this is an area where, maybe a conference all by itself on the way in which, way it actually plays out on the ground in families. I do think that we do provide, through refundable tax credits, federal, state, local, EITC, and child tax credit, support for low-income working families. And I think that's a good thing. And I think the more that we make sure it both provides assistance for people to provide adequate care for their children, but also always incentivizes work, is something we should focus on. And we didn't even mention paid leave.
Oh, there's Karen. There's one.
Maybe we'll get to it.
Yeah.
So I just wanted to follow up on that comment about so one of the things we know from the research on like parental employment and children's well-being is that there's the best situation for children in the very earliest stages of life varies quite a bit, right, in terms of the parent, what work opportunities they forego by staying home versus continuing work, what the options are for the kids. And you were just mentioning, Robert, the complexity of our current system. So, one of the things, I don't know if this is, and I'm sure Belle has talked about this too, is, if we thought about rather than child care, but child allowance. So for example, the parent that wants to and benefits from the child benefits of the parent staying home uses some of those resources to replace income that's foregone by not working, versus giving the parent the full choice to say, I'm going to use it for childcare, I'm going to use it to supplement for income that I'm foregoing because I'm staying home with my child. And I don't know to what extent you think that is a politically viable option.
You go ahead.
Well, I'm not sure it's such a big topic, but, I mean, we do have a child tax credit right now that's quite generous, as you know. And the problem is, as has already been said, I think it was Irv, it is not fully refundable at the bottom. And you may have an argument about what's the difference between a refundable child tax credit and a children's allowance. I don't see them as being that different, but you can correct me if you have arguments about that. And I think the problem is the one that Irv identified and that Senator Rubio did try to work on and failed. I also think that there is some advantage to, or at least there's a difference, we can argue about which way it goes, between child tax credits, as Robert just said, and child care tax credits. One is linked to either work or going to school. In other words, you have to either be working or going to school to get it, and the other is not. And as you just said, some people believe that we should be supporting caregivers and enabling them to stay at home. I don't think it's ever going to be, anytime soon anyway, politically feasible in this country to pay people to stay home. We used to do that. It was called AFDC, and it kind of went away because right now the focus is on work, and I'd like to sort of go with the momentum right now on a more work-oriented agenda. I will say something while I have the mic, and since nobody's hand is up, about paid leave. I mean, I think really, as I mentioned briefly, we have a labor force participation of women that granted is much higher than it used to be, but hasn't been increasing since about 2000. Now, those of you in the research community know that, but I don't know if everybody else does. And the other thing that's really notable in my view is it's much lower in this country, the female labor force participation, than it is in other advanced countries. And one of the reasons for that, which has been documented with very good research, is because we don't do enough with either child care or paid leave or other policies that make working and taking care of your family possible or easier.
So I'm just going to say something on the child allowance too, partly because we have proposers of two different child allowance proposals in the room. I mean, so it is worth saying, so I don't think there's any chance of one being enacted anytime soon either. I also
the advantage over child tax.
and I also don't see that it's necessarily a difference whether you do it through the tax system or whether you do it through a check.
It'd be a lot politically easier to do it through the tax system.
Yeah. I mean, so the one tougher thing is potentially if you wanted to do it monthly, cutting checks or doing transfers monthly, but it could be done. But it is interesting that there are both empirical child support or child allowance randomized trials going on. So Baby's First Years, which is a 5-site that's going to study a monthly child allowance on brain development, on normative child development. And there have been multiple proposals from both sides of the aisle in the last 5 or 6 years where people have proposed how to pay for them and, what you would do to implement. And so the Mary Ann's, I'll go with the custom of the day, have been co-authors on one of those proposals. Irv Garfinkel has been on another. And so one thing I was just going to ask if you want to comment on the overall scheme and if you see a benefit as opposed to just doing a larger or fully refundable tax credit, child tax credit, And, whether you see some efficiencies to replacing some of pieces of existing programs to help pay for it. And one of the reasons I want to bring it up is because when Marion Bittler talked about the universal basic income at a high level, at $12,000, it was whatever, $3 trillion or whatever it was. But the estimates for the child allowance are much, much lower. I mean, it's also a less generous benefit. So do you want to?
Sure. So the chart I showed, where I showed what the sum of the ITC, the child tax credit, and the exemptions was, that was kind of pump-shaped to make the point that people at the very bottom are not getting those tax benefits. There was a straight line there. If you repurpose those, people who were getting a lot of the ITC would do worse, but you could give $2,000 to every kid. Now, obviously, we just reformed the tax system, so that's not going to happen. But you could afford to pay for around $2,000 for every kid by repurposing those things. And if you're willing to, if you want to keep the work incentives of the ITC, you would just have to spend more.
What about the in these child allowance proposals about the responsibility of the non-resident parent? Is there a requirement that they be in the 4D program? Because that's also part of the political dynamic. Americans, are willing to support families, but they want families to do their part too. So if you're going to provide a further benefit to households with children in them, and then not do something about ensuring that the non-resident parent is paying something or providing something. In the dialogue we had with Maria, that was the give. Provide more assistance, but require support.
So, as you know, I'm very much in favor of child support enforcement, but I would not make that a criterion for getting a refundable tax credit. I agree with Bill, the economic difference between a fully refundable child tax credit and a universal child allowance, they're identical economically in terms of cost. But I also agree with Lonnie, the difference would be how you administer it. And I think it's crucial for families with children to get payments once a month regularly, not just as in the EITC once a year. But in the proposal that we've been working on, literally, if you do $2,000 a year, you could keep the EITC. You could even expand the EITC, which is, I would be in favor of. I'm very pro-work and I'm pro-marriage, too. But work, we know a lot about how to incentivize and encourage work. And the EITC does a wonderful job at that. But that's not the only issue that is at play in terms of child development. And economic security is really important. We have good evidence that insecurity is really damaging to child growth and development. And right now, the number of families with children that are economically insecure is really big. And this would make a big difference, especially in
Do you want to continue this debate or not?
So my brother just moved to Canada and had a baby there. And it struck me, not only does he get $200 a month in a child payment, which I would agree functionally is completely different from giving them $2,000 a year once a year. But the mother gets a month of maternity leave, and then either parent can take a year of paid parental leave after that. And so that struck me, Robert, you said you want to encourage work, and Canada is essentially actively discouraging work for the first year of the baby's life. How literally should I take your words if we want to encourage work? We want to encourage parents to get back to work a day after the baby is born, a week, a month, a year, a decade. At what point do we want to encourage work?
There is research on this.
There
is some research that suggests that, roughly, I mean, obviously there's no absolute number here, but roughly after about 6 months, it actually, longer periods of paid leave discourage mothers from ever coming back into the workforce. Now, I personally would not like to see women going back to being, full-time homemakers and mothers and being discouraged from having careers. So I'm all in favor of a certain amount of paid leave, but I think that the European countries, and maybe Canada as well, well, probably not Canada, but the European countries who have very long paid leaves for mothers mostly, not fathers, did it because they were worried about fertility, and they put those laws on the books in the wake of a decline in fertility and in the wake of World War II, and I think they haven't been updated. So yes, let's have paid leave, but let's not go back to encouraging women to stay home and be full-time mothers.
In New York, in the wake of the welfare reform bill, we imposed fairly strict work engagement requirements for new mothers on cash assistance. I think it was 6 months, it might have been. And, well, we've mandated childcare. You can't require someone to do something unless you also provide childcare in that circumstance. And that was a concern about what the effects would be, and we watched it. And I think we got certainly more work and greater income, and I think less poverty. And we didn't get significant increases in, or any increases in sort of downside effects for children. So I was worried about that. That's a pretty strong requirement. If you want cash assistance, we're going to ask you to go back to work within 6 months. And, a disaster did not occur, and I think a lot of benefits occurred.
I'm not familiar with this child allowance, any discussions on the details around it. And I'm just wondering, I think there's a lot of research on benchmarks that need to be met for children between 0 to 5 in order for them to be kindergarten ready that are not only preschool. And that family has a really important role to play in making sure that they're meeting those benchmarks. And I'm just wondering if the conversations around this child allowance contemplates, I'm saying this, I'm worried that it's going to sound bad, but contemplates imposing certain requirements on the family that they're meeting in order to get it, to make sure that their children are developing appropriately, like making sure they're going to their well child visits. On the American Academy of Pediatrics benchmarks, those types of ideas.
So in our proposal, I think our thought process, and we got many times on these characterize, was that, kids should, whether or not they're getting support from the government shouldn't be contingent on whether their parents are working. And I also think we weren't thinking of this as a conditional cash transfer, so what you're talking about sounds a lot more like Progressa or some of these conditional cash transfers. We are thinking of an unconditional cash transfers because we're a rich country and we can afford it. But I'm sure other people contemplate other
In New York City,
ideas.
under Mayor Bloomberg, we implemented an experimental program on a conditional cash transfer with regard to, I think, healthy doctor visits, school performance, and I think the results were mixed in terms of its effectiveness.
Very good.
Robert, I agree with you. We have to do a childcare thing all by itself.
Yeah.
Childcare, I'm going to talk about my state because I don't know about the rest of them. We got huge childcare deserts, particularly in the rural areas. So we can talk all we want about putting moms to work because it's mostly moms, but there are some places childcare is just not available. The second thing with childcare is that you want a consistent workforce, and childcare workers are not consistent. They're turning over a lot because we don't pay them a lot. You get more money going to work for Walmart than you do doing childcare. So the affordability of childcare right now is an illusion, I believe. The working poor basically can't afford childcare, and if they could, if they have it available, they can't afford really good childcare unless the state supports us in some way. And the other one that I don't think most people have looked at is that low-income families, when they send their kids to school, have an educational that's
deficit at kindergarten. And so what we need is a child care system that actually starts to bridge that gap. We beat up on the K through 12 because of the educational gap, but it actually starts at home. So one of the things that good child care quality would give us is a way to start to deal with the educational gap earlier. The second thing is that it relieves some of the pressure on single parents. So it's not just about working, it also relieves some of the pressure on having to do this all by yourself. So to me, child care has more than just supportive of work. It's also supportive of low-income kids, and it's also supportive of giving single parents some relief. And so I think when we talk about child care, there's a lot of things we need to be talking about here. And one of them is, the biggest one for me, is that in the rural areas, we don't have a lot of child care.
I, of course, agree with Secretary Eloise Anderson about the child care, but wanted to mention this $2,000 figure that you all are talking about, because if you look at what parents spend, either through our national survey that we funded of the whole country nationally representative, the costs for those who pay are somewhere around $5,000 to $6,000. And then if you look at the pricing that gets put out as averages state by state from like Child Care Aware and others that do that, it can be $10,000 to $20,000 a year. So I guess I'm struggling with the $2,000 figure and the big difference that you all think it's going to make.
Well, I think there are people here who think it's going to who are in favor of it. And I think one of the things that I'm sitting here thinking or wondering about how they're thinking is you can't live on $2,000 a year. So you've got to presume that people are working or at least married and living with someone who's working. Otherwise, this $2,000, all it's going to do is, just boost your income some. I'm all in favor of boosting income, but why not boost it because it's so much politically more feasible through something like the Earned Income Tax Credit, or what I call a worker tax credit. And I couldn't agree more with, Eloise, is that right? Sorry. That your point about that we need good child care, and if I had to choose, we don't have unlimited funds politically. I mean, I understand we're wealthy, and but if I have to choose between spending money on high-quality child care and an EITC versus the children's allowance, I'm going to fix the first two first. So it's a priority issue.
So we've done a remarkably good job, despite technical issues this morning, of staying on time, and I'd like to keep it that way. So we're going to have some closing remarks from Brenda Destro, and I will introduce her as she walks up. So she is an incredibly busy woman these days, wearing multiple hats. So she's the Deputy Assistant Secretary for Planning and Evaluation. She's currently also fulfilling the responsibilities of the Assistant Secretary and the Principal Deputy Assistant Secretary for Planning and Evaluation. So she's going to speak with all three roles of those. Yeah. So prior to coming to ASPE, she served as a policy advisor to the Assistant Secretary for Health at HHS. She was also a public health advisor in both the U.S. House and the Senate. So thanks for joining us, Brenda.
Well, I'm going to provide some closing remarks for today, which has been a wonderful exercise in learning new ideas from panelists who are have done such outstanding research and giving us new ideas. The forum brought together, as I said, rigorous data analysis and research findings that can really move policy in meaningful ways to increase opportunity and independence for American families. So we learned that we learned some new ideas for increasing work, which is, of course, the cornerstone to gaining and maintaining independence, as well as how to think about employer needs worker skills, and training opportunities together so that both our economy and our families can thrive. We heard about something that I'm quite interested in, social capital and networks, and the importance of strong social relationships in the lives of individuals and families. And we gained valuable insight into how we can help increase economic stability and mobility across generations. So thank you for conducting and to our panelists, thank you for conducting and sharing such valuable research with us today. And of course, to our final panel on the policy ideas and directions and helping us to skillfully weave together all the rich findings shared today. But for me, as a social worker, I think one of the most interesting areas that I found today was to have the opportunity to learn how to build services and strategies around what individuals and families really need to move to self-sufficiency and to provide for themselves rather than starting with government programs. And that really brings us to the opening remarks that Steve Wagner made on engagement, and my other colleague, I think Clarence Carter, kind of flushed out for us. So engagement with families, and then building the social networks and the social capital that our social system then can hand off some of these very fragile families to another network that will help continue and support the growth and change that they're going through. We at ASPE are very excited to start incorporating these findings and ideas and new possibilities into our work, both with the National Poverty Research Center as well as more broadly within HHS. So a big thank you to our co-sponsors, the Institute for Research on Poverty at the University of Wisconsin at Madison, the Center for Poverty Research at the University of California at Davis, and the National Association for Welfare Research and Statistics. And most of all, I want to offer my gratitude for all of you, our participants, both here in the room and joining via live stream, especially our state and regional partners who took time out of their very busy schedules to join us and help us better understand how collectively we can further advance the research, practice, and policy agenda to rethink our welfare system, creating greater opportunity for independence among all families. So thank you very much, and we look forward to working with you going forward.
So I really don't have much to add, except that, Robert mentioned on the last panel that, one of the best outcomes from events like this is to stimulate thinking. So I hope that this both collectively and individually gets us thinking, and that thinking goes on as we leave the room and go back to our regular life roles. I also want to thank our partners in organizing, UC Davis and NAWRS and ASPE for their funding, support, and partnership. And thank you all for a great day of discussion.